It is June the 14th. Winter has arrived in South Africa with temperatures dropping to below 0 degrees overnight. Lockdown level 3 continues to confound us and confuse us, with some schools opening slowly, places of worship officially being allowed to open, but with most choosing to remain closed. Last week, we saw a spike in the numbers of cases, with more people either becoming ill or coming into contact with those who are. South Africans are starting to push the boundaries of compliance, and in doing so, are placing themselves and each other at risk. Positive cases are being kept quiet, which means that positive results are carrying a stigma. Good morning. I'm Howard Feldman. This is the Synthesis Sunday podcast with COVID expert Dr. Anton Meyberg. Good morning, Dr. Meyberg. On Friday, on my morning show, you expressed a passionate plea for us to take this seriously. Can we begin with an update as to where we are and why you felt the need to do that?
Good morning, everybody. So I think let's start with the numbers as we normally do, and then I'll explain my thoughts and my process behind that plea. There are currently 7,875,929 cases worldwide, with 432,519 deaths, and there are 4 million recovered cases. The United States has 2.1 million cases with 117,000 deaths, and South Africa has gone up to 65,736 cases with 1,423 deaths. 3,809 new cases yesterday. Gauteng is sitting on 9,897 cases, and the Western Cape is sitting on 40,000 cases. The grim forecast for the 12th of July, 1 month from now, is that Gauteng will be sitting on 55,000 cases with 371 deaths, and the country will be sitting on 335,000 cases with 5,400 deaths. There are currently 2,359 plus minus patients in hospital throughout the country, with 138 ventilated patients and 326 patients in ICU. Our public hospitals are starting to take strain. Charlotte Makwekwe Hospital, Joburg Gen, is sitting on over 160 positive cases with multiple ventilators, and Chris Hani Baragwanath has 25 cases with 4 ventilated and over 65 people under investigation. Helen Joseph Hospital is sitting on 16 patients. So we're seeing a massive increase in the amount of cases in the public and the private sector. And my plea on Friday was to make people aware and let people understand that this is it. We have hit COVID-19. It is here now, and it's not going anywhere quickly. It is now time to be responsible, to look after each other, and to not be selfish to each other.
It's very confusing because we have reached lockdown level 3. We were at 5, now we're at 3. There's a lot of confusion as to what that really means. But essentially, as the president said, the responsibility is in our hands. From your observation, are we behaving responsibly?
Well, I think just to clarify that statement from the presidential side, I think it's a complete failure from the presidential side and from the presidential statement to say that, first of all. I think we are in level 3, but there's no definitive guidelines what people are supposed to do. Yes, you can go to a gathering of 50 people at a religious organization, which is what they're saying, but no, you can't go to a dinner where there are 30 people. So there's no congruency between what they're saying and what they're telling people. People aren't understanding the severity of what's going on and how important it is to actually isolate and stay at home, even though the lockdown has come down to level 3. It's so important to understand that if you don't need to go to work and if you don't need to go to the shops, stay at home. Don't socialize. Public and social distance. We need to look after each other.
All right, let's get to some of the questions. Philip wants to know 2 questions about masks. Number 1, masks are to stop droplets of liquid, but what about naked viruses which are submicroscopic and will go right through the mesh of the masks? And question number 2 is, masks cover our nose and mouth, but what about viruses going into our eyes? Let's just focus for a moment on masks.
So that's a fair question. You've got to understand that, once again, this is a respiratory virus. It's a droplet spread virus that can be aerosolized, but it's not sitting in the air the whole time. The whole purpose of us wearing a mask is not only to prevent us from getting sick, but it's to prevent other people from getting sick from us. So if I'm a positive asymptomatic carrier, then I don't spread the virus to other people by me wearing a mask. With regards to the naked virus and the submicroscopic virus, we must understand that surgical mask works in a different way to a cloth mask and a different way to an N95 mask. It does protect you from viruses entering into your mouth and into your oral cavity and protect your nose, but to a certain degree. They are very effective, but you cannot stop every single virus from entering through those things. But the viruses that we're interested in is well protected from the surgical mask, from you wearing one and someone who's symptomatic or asymptomatic who's wearing one. With regards to visors, we still don't advocate that you should be walking around with a mask and a visor at this point in time. It's more important for your healthcare workers who are dealing with patients, who are aerosolizing, who are coughing, who are speaking to them without masks, for those people to wear the masks and the visors at all time. And by healthcare workers, we mean doctors, nurses, physiotherapists, OTs, any of the allied therapists that are working on those type of patients.
All right. And before we even carry on there, I mean, you mentioned a lot about what's happening in public health. What are you seeing? And obviously, you need to be cautious as to what you can talk about that's happening within your own environment. But what are you seeing in your world, in private hospitals?
So we are seeing what we expected to see. And I think there's a lot of disgruntled people out there saying, what was the purpose of lockdown? It's very important to understand the purpose of lockdown was that we could be where we are now, knowing what we know. Lockdown has given us in the health setting, in the healthcare workers, an opportunity to understand how much better the virus works and how we can tackle the virus, what medications we can use that will help us in fighting the virus, and what options we have. If you would have asked us 3 months ago, we would have said every single patient who's got low oxygen levels needs to go on a ventilator. Now we've changed that thinking. Not every patient needs to go on a ventilator. In fact, we try and keep people off ventilators. So at this point in time, even our private hospitals are filling up. Our ICUs are getting full, our wards are full, our high cares are full. And essentially, once that happens, we're going to start running over into the other general wards and take over other general wards and stop elective surgeries and things like that from happening because we won't have space for other patients. So we're in the middle of the pandemic now. We haven't reached our peak by no means, but it's going up quickly at this point in time.
Right. There's been a lot of talk and asking the question about blood types. I saw an article and she was referring to it that there's a suggestion that people with blood group O are associated with lower risk. Have you seen that?
So I think we've got to be very careful with the articles we read. A lot of articles are not peer-reviewed and they're done on a small amount of people. So there's a few articles saying that if you've got an A positive or an A blood type, you're at a higher risk of getting ventilated, whereas if you've got an O blood type, you're at low risk of getting ventilated. And these aren't peer-reviewed trials. These are trials that are done when they look at, let's say, a cohort of 500 people, 230 people of that cohort were O positive or O negative, and they perhaps didn't need to go onto ventilators. But we can't use this as our mantra and saying that if you are O positive or O negative, you're not going to need to be ventilated. And I don't really think it makes a difference in the whole picture that we're seeing, because it's not going to change our treatment outcome or our outcome overall. I don't believe they're going to do blood tests to decide if you're O positive, O negative, AB, A positive, will make a decision for us, granted, for us what to do in the hospitals. So at this point in time, it's a non-necessary test to do.
Are we seeing anything different now that you are treating a significant number of COVID patients in South Africa? Are we seeing, and John T is asking the question, for example, are we seeing getting any further information about BCG, if that's having an impact? Are we seeing the South African cases behaving the same or differently to what your colleagues are seeing overseas?
So we're seeing the South African cases behaving exactly like they behave overseas. At this point in time, there's no credence or credibility to the BCG giving us any benefit. They are doing studies in Tygerberg, they are doing studies all over South Africa, but we'll only be able to give a proper answer to that in about a year's time, when they've seen what happens with this COVID pandemic, how many people were affected, how many people actually got the BCG, and how many people got extra BCG in this trial to see if there was a difference from anything. So at this point in time, no, unfortunately not, the BCG theory is not holding.
All right. There's a lot of questions around, and it's quite interesting because the questions always reflect exactly where we are with this pandemic. And what a lot of the questions now are around the fact that people are coming into contact with people who are positive. What must they do? Nikki Winnick asking that question, Merle Beda asking these questions. What happens if our child comes across somebody another child whose parent was COVID positive? It's starting to become a very relevant and real question for us.
So that is true. It's very real and very relevant. And I think we've got to go back to the whole thing now, also discussing stigma related to it. There's been a number of cases this week at certain schools where people have come out as positive, and the people have been lambasted for saying that they're positive because they didn't keep their kids at home or they took them to parties. And we've got to be very careful what we believe and what we hear. There's a lot of people on social media that make bigger things of things. I think it's important that we have to know who is positive in order to protect ourselves and protect our children. So if you've told someone that you're positive, well done to you. That's what we need, because that way we can protect other people around us. It's very similar to doing a screening test on someone when they come to a school, for instance, when you're checking the temperature. If the temperature's up, you send them home because you're worried about them potentially being positive. But if you told us that you're positive, we applaud you because we know that this will help us keep other people safe. And by keeping other people safe, we can trace back where you've been and what you've done. And in that vein, it's so important that people don't have play dates, that they don't have any social interactions, no dinner dates, no meals together, so we can prevent the spread of these things. If you're in an office, if you're in a boardroom, wear a mask, observe social distancing, observe public distancing, keep your mask on the whole time, so that if you do perhaps come into contact with somebody who's positive and who isn't wearing their mask, it shortens your duration of need to isolate yourself. And what we are suggesting is that if you have been in contact with somebody who is positive and you don't have protection, and let's say you're not wearing a mask, then isolate yourself for 14 days. Quarantine yourself in your house. It's not necessary for you to go have a test unless you become symptomatic or unless you're over the age of 65 and you've had comorbidities like hypertension, diabetes, COPD, and things like that. But not everybody who's been in contact with somebody who's positive needs to have the test. We will absolutely destroy the economy and we'll destroy the health services if every single person goes for a test.
Okay, so let's understand this. I come into contact, I'm wearing a mask, and I've been in a meeting with somebody who then phones me later to say, I wasn't feeling well. I went for a test. I'm COVID positive, but I was wearing a mask. I didn't shake hands. Perhaps, I'm in an office. I might have touched something around the place, but we've been careful. What should I be doing?
In that circumstance, when you're wearing a mask and the other person was wearing a mask, you observe social distancing and the person is positive, I would recommend that you stay at home for a week. And then if you develop symptoms after a week, go for a test. If not, you can go back into general public.
So in that case, it's a week. But if I
in
haven't
that case,
been
I would
wearing
recommend
a mask,
if you are not wearing a mask,
right,
and this is very important, if you are not wearing a mask and the other person is not wearing a mask, you are a high contact, especially if you've been in a meeting for more than 15 minutes. Then you are extremely high contact. And then you should go home and stay at home for 14 days at least. Once again, you don't have to test unless you've got comorbidities or unless you develop symptoms, fever, loss of smell, sore throat, cough, shortness of breath. But rather stay at home then for 14 days, isolate, quarantine. And at the same time, you've got to understand what that means. That doesn't only mean you staying at home. The way we live at the moment, we all live with our families together in the same house. So unless you go home and quarantine yourself in a separate room without using the same cutlery, crockery as your whole family, then you may as well quarantine your whole family because you'll spread it otherwise. And if you're with your family, 14 days is the time not to stay with them in quarantine.
Right.
This is the only way we're going to be able to prevent the spread.
Can we just talk about false positives? Somebody sent a question saying that George Floyd, in fact, when they did the autopsy, was COVID positive. I obviously don't want to go into the politics and the issues around that, but it seemed as though the time span that he was positive for was quite a while. I don't know what is fact there or not, but let's just talk about false positives, how long it stays in the system, and when it is safe to interact with other people.
So I think there's two very good points there. The first of all, about someone being positive and not dying from COVID. Okay, there's going to be a lot of deaths that are going to be called COVID-19 deaths that are not actually from COVID. If people who are well, example, Mr. Floyd, who didn't die of COVID, but died of something else. So we wouldn't call that a COVID-19 death, but the authorities would mark it as a COVID-19 death if the person is positive. So we've got to be very careful about naming that as a COVID death. Okay? At the same time, there are a lot of people who are going for tests who are asymptomatic and getting a test back and finding the test positive. They don't believe the test result, so they go to a different lab the next day and then get a negative result. Now, whether it's a false positive result or not, it's a positive result. You have to say that that result is positive. Each laboratory uses different reagents, different strips, and different mechanisms to work out and test the reagents and the swabs that are done in their lab. So to have the swab done at a different lab is futile because you're going to most likely get a different result. The NICD, the CDC, everyone is saying that if you've got a positive result, you treat it as a positive result and there's no need to go have yourself re-swabbed again. You need to isolate for 14 days. And then if you have symptoms, you get treated accordingly. But if you get a negative result and you've got symptoms and you're coughing and you've got a fever, that can be considered a false negative result. And we do have patients in hospital that have got negative results, and we still believe that they are COVID-19. And there are other tests to do. There's not only the reverse transcriptase polymerase chain reaction that we're doing, there's other tests that can be done on saliva, for instance, where you get a better marker of understanding if the test is positive or not. But some cases, you are not going to get the viral shedding that you would expect to get, even though the patient is ill. But if they fulfill all the criteria, then you treat them as a COVID-19 case, despite the test being negative. And that's what's called a false negative.
Brad asked me to clarify the difference between asymptomatic and presymptomatic, because there seems to be talk, or there was an article that the World Health Organization released but then retracted, that asymptomatic people can't spread the virus or spread it or have less chance. They then walked back from that statement, and I'm very, very confused. But there seems to be a difference, Brad saying, between presymptomatic and asymptomatic. Can you clarify that for me, please?
So first of all, that article by the World Health Organization was a very dangerous article and was retracted, thank God. They said that it's very rare for asymptomatic people to transfer the virus, which is absolutely untrue. Now, if you look at asymptomatic people, these are clarified as people who have got no symptoms and don't develop symptoms throughout the course of the infection, but are still COVID positive. Whereas a pre-symptomatic person is a person who's got no symptoms, who's tested and comes back positive, and then develops symptoms at a later stage. They do believe that the viral shedding on the pre-symptomatic people is higher than that of the asymptomatic people, but believe you me, the asymptomatic people are still spreading the virus. 30 to 40% of the population will be asymptomatic. And I think it's also very important to note that just because you've got COVID-19 does not mean you are going to get severely ill. It does not mean you're going to go in hospital. It does not mean you're going to get sick. 85% of the population will be okay and be treated as a normal flu, essentially, and won't even know they've got symptoms. And of those 10% that have got symptoms, they'll be mildly sick. It's the small cohort, the 5% that will be critically ill or severely ill. So you don't have to sit there going, oh my God, what happens if I get COVID? You've got to understand the majority of people do very well getting COVID-19.
Right, and seeing some of the questions that are being asked, I can imagine what you get to see. Stephen says, can you please ask Dr. Meyberg if washing sex toys must be for at least 20 seconds like washing hands, or can it be shorter?
I think there's a break in I can't hear, so I think maybe we should go. I really can't hear what you just said.
All right, so moving then on to another question. You'll be amazed at some of the questions that we are asked. All right, a lot of people, a lot of discussion again, and we're going from one extreme to the other. A lot of people asking again about places of worship. They've sprung up all over Johannesburg. They otherwise known as secret minyanim. And I guess the question that a lot of people are asking is, considering that, and it's not only happening in the Jewish community, it's happening, certain churches are open. We see it happening in the Muslim community where people got together for Eid and Eid celebrations and became ill, unfortunately, following that. So we're starting to see, we do see this happening all around. Is it better to open an official place of worship with strict stringencies, or continue as we are, not allowing these to happen, but having all of these secret or unauthorized places opening up? What's your thoughts?
So my thoughts are neither are good. They're all bad. We do not want to open places of worship. I know, speaking for myself personally, I think it would be a disaster if we opened up religious services. And I think these private services that are held at home are as dangerous, if not more dangerous. People are under the misconception that if you do it in your own home where there's 10 people there and you do it outside, it's not a problem. But we're now in the depth of winter. We're going into this freezing cold weather. No one's going to want to go outside. And most viruses are transmitted indoors when people are coughing on each other, firstly. And secondly, people go to the religious gatherings, not only for the religious side and the prayer side, but for the social side as well. And you cannot curtail that. So I don't believe we should be having any secret minyanim. I think if people are having these secret places of worship, they are negligent and they deserve to be held liable. And if they open up the synagogues at this point in time, I believe it's pure negligence. I think we've seen from the outbreak after the Eid event how dangerous it is for people to congregate together after social and religious events. So I think we've got to be very, very careful.
So you still maintain, and Michael asking this question, you still maintain that schools should be open, but places of worship should not be?
I do believe so. And obviously it's a much easier thing to do in a private school who have got more facilities and easier ways to access PPE and easier ways to screen and easier ways to do things. And it's not easier to test people. The private schools, I can speak for Johannesburg at least, are doing an unbelievable job of screening, of making sure that their kids are doing the right things. My own child is back at school in grade 1 and they're doing an unbelievable job. He's wearing his mask, he's social distancing, he's public distancing, he's doing his hand hygiene, he gets checked, there's no unnecessary touching or hugging, the children are staying away from each other. When they go into the field, they sit in hula hoops with 1.5 to 2 meters distance. So yes, I do maintain that the kids can go back to school. Obviously, we do know that there will be a child here and there that will get infected from their parents who are bringing it home from work, and we will tackle each case individually as they come along. We won't have to close school for every case. We'll tackle it on each classroom is considered a bubble. And if necessary, you'll close that bubble if there's a patient or a classmate in that class that is affected.
Barry says, what is the latest or current thinking about transferring the virus through surfaces? Has this changed? Where are we at with this?
We still take care of the fomite spread from surfaces. In other words, bacteria, germs, funguses, anything spread from that point of view. And that also goes back to the synagogues. Yes, people will bring their own books and this type of thing, but everyone's still touching surfaces. Everyone's moving between things and touching things. So you still got to be very careful. At the schools, they clean the desks every hour, every sort of intermission between classes. They're cleaning things, they're cleaning all the surfaces. So you still do need to be careful.
Do you have a sense as to when we will peak? The numbers are quite scary. As you've said, the projected numbers for a month's time, very frightening. When will it peak here in South Africa, in your view? So
I think it's going to happen sooner than later. We're now going into winter. Influenza is going to hit us as well, whether it be influenza A or influenza B, whether it be the RSV virus and the adenovirus, all the other viruses. I think by the end of July, we will have peaked. Because I think with the cold weather and keeping people inside, and as I say, we can't keep people away from each other, unfortunately, although we want to, people are going to spread the virus and get sicker. And it's natural to get sick in winter with influenza A and influenza B. But now we're going to have the dilemma of deciding whether it's influenza A, influenza B, COVID-19, or are they correlated at the same time? So I think we're going to see the peak towards the end of July.
What do we do if, and now that it is winter, if we get a cold? How do we know what we're dealing with? Must we isolate? Must we not isolate? We don't want to feel. I'm come from a very, very long line of very serious hypochondriacs. So for me, why are you laughing? It's not that funny, only because you have to deal with it some of the time. But I come from a very serious line of hypochondriacs. If I get a cold, there's no doubt in my mind I'm going to be COVID positive. But what do we do? What do hypochondriacs do? What do normal people do?
So there used to be an advert that said you can't take every cough to the doctor. And I think that's true at this point in time as well. You can't take every sniffle to the doctor. And that's why it's so important that if you are in the work environment or if you're in the school environment, you need to be honest when you're filling out your forms about the screening. Screening is an extremely important tool to tell people, have you got any symptoms? Not every sniffle is COVID-19. It can be an allergy. It can be a mild virus. But if you've got a temperature and a sniffle, then you need to take it up a notch and discuss it with your doctor. And you can take it to your general practitioner, and they will tell you, do you need to worry? Do you need to isolate? Do you need to do bloods? Or do you need to do a COVID test? So you can't worry about every sniffle, but if you're going out into the public and dealing with people, you've got to be responsible and honest enough to let them know that there could be an issue and you don't want to co-infect them.
So should we all have thermometers at home?
I don't believe that's necessary. I think it's like everyone's saying, should we all have oxygen saturation meters at home? And I think it would drive us more insane than anything else. But you can tell when your temperature's up or not. You don't have to know a specific number, but if you're unwell and your temperature's up and you've got a sweat or you're feeling very warm and you're sniffling and coughing, that's enough of a reason to understand that you're not well and you should take it up a level.
Your thoughts again. I just want to go back to the stigma issue, because I know that you addressed it, but for me, this is a very, very big concern. The more people I speak to, the more I realize how nervous we are to say if somebody's got it or not. You're saying the person who's infected should tell people they shouldn't. There's nothing that they need to be ashamed of. How do we get this message out there?
I think we get it out there by imploring people to understand that you've got to observe all the nuances, all the pillars of protecting yourself. And that's the only reason that would stop people from wanting to go out there. Because if you aren't observing social distancing and you aren't practicing that, then people are going to be upset with you. And that's understandable. But whether they're upset with you or not, you've got to understand that it's your social duty to let them know what is going on so they can take it further. Because part of the treatment and the development and the eradication of this disease is tracking where it's come from and who it's going to, and to stop the spread and to stop other people getting sick. So there's a huge stigma about it. It's very similar to when HIV came out, and we've got to get rid of that. We need to know numbers so we can protect each other.
Is there any good news?
So there's fantastic news. And this is probably the best news of the year at this point in time. There's no better news than to know that this week the English Premier League is restarting and Liverpool needs 6 points or 2 games to rightfully win their rightful and well-deserved title. I mean, there's nothing better than that. And I think going back to my whole unicorn talk, etc., I think we've got to understand it's actually not a unicorn at the end of the day. It's a horse with a sword on it that protects our hopes and our dreams. And to quote, your beliefs don't make you a better person. Your behavior does. So I implore you, I beg you, I beseech you, I urge you. I ask you from someone who's on the front line, someone who's seeing it firsthand, from someone who cares and wants to see things maintained and managed. Be safe. Wear your mask at all times when you're going out. Every time you leave your house. No play dates. No social interaction. Hand hygiene. No dinner parties. No Shabbos meals. Social and public distancing. Wash your hands. Wear your masks. Don't be selfish. Just be safe.
I'm Howard Feldman. This is the Sunday Synthesis podcast with Dr. Anton Meyberg. We chat to him every Sunday. We get an update as to what is going on in the world of COVID with the pandemic. Thank you for watching. Thank you for listening. Send us your questions, and we will certainly try our best to answer them. Stay safe and wash your hands.